Growing up in Indonesia, that's why my love for animals like grown, and the animal welfare issues that's very apparent in Indonesia as well. But looking at Indonesia now, there's a lot of NGOs out there with the vets that are very passionate in welfare that try to help and to tackle the problem. It's sad to see because I grew up surrounded by a lot of strays. Usually it's cats. The cats, they change every few months because I know maybe they die from the viruses or they die from the hit by car situation.
Today's special guest is Adinda Rana, an Indonesian-born veterinarian who's qualified as a veterinary nurse in Australia, known for a deep involvement in animal welfare on a global level, from developing shelter medicine protocols in Southeast Asia to serving on the Wasaba Animal Wellness and Welfare Committee. Adinda brings a unique global lens to the difficult decisions we face in veterinary care. Today we're diving into some of the big, uncomfortable questions about euthanasia, treatment limitations, and the intersection of finances and ethics, and what both professionals and the public can do to improve welfare worldwide. Very warm welcome to Rana.
Thank you so much. I'm really honored that you invited me to this podcast.
You obviously are on social media. I love the fact that you are very transparent with some of the stuff that you're doing, particularly because you have had quite a complicated journey, haven't you, from qualifying as a veterinarian in Indonesia and now living in Perth. Tell us a little bit more about that. Start with that.
Okay, so I graduated mid-2023 from Indonesia as a vet, so like a vet doctor. And after that, I immediately moved to Australia because I have my stepdad, my mom, and my partner here. And because I know that it's not going to be recognized. So actually, I have been planning to do that since I think in the early years of my vet study. So I kind of like looked into how to get my degree transferred if I want to go to Australia. So that's why I work as a vet nurse first before I go through the exam to be able to get my degree recognized in Australia.
So you clearly have a love for learning, don't you? You've set multiple exams. and you, yeah. And you talk about it quite openly on social media about, your love of studying and being very acceptant of your journey. I mean, I think that probably had helped, didn't it? Sort of recognizing that potentially your veterinary degree would not be recognized and that you would have to undergo further examinations in the country that you are hoping to practice in.
Yes. Yeah. And then, so the plans actually kind of changed because originally in WA, in Western Australia, where I am now, you don't need to get a certification for vet nurse degree, actually vet nurse profession. But they changed it on the same year I graduated. So I need to actually do another 1 year study to get the registration.
And I believe you've qualified. So congratulations. Yeah. You must feel very relieved. Now, there is something quite special, and I'd love your perspective on it, but there's something quite special about veterinary nurses. And there's something that we lack, potentially, or some. I talk for myself, I can't talk for all veterinarians, but that we lack from a nursing perspective, because nurses are great at maybe recognizing some of the welfare issues, some of the behavioural issues that maybe us as vets have not historically been practiced at doing. Have you found that you've gained a huge amount by doing both qualifications and it's given you a more rounded experience?
Yes. I didn't realize before that doing nursing is actually a bit harder than I thought because, well, at least at my workplace, the vets, they kind of like decide what the medication is going to be, what the treatment's going to be and everything, but they don't actually look at the patient all the time. We do have rounds, like morning rounds, evening rounds, night rounds, stuff like that, but the nurses are actually the ones taking care of them every hour, every minute. So when there's something changes, even though it's like going through like the same with the treatment, but then there's changes with the animals that the vets may not see because the vets are busy with the paperwork and everything. It's the nurses that notice it first. So we're going to have to voice it up to the vet and then maybe change the treatments or something like that.
And I mean, this obviously gives you a great opportunity just to sort of see it from multiple perspectives, to see how you will be practicing very differently potentially when you do take on the veterinary qualification in time.
Yeah. I think it just broadened my perspective, and I will get more hands-on before I actually do vet job in Australia, because looking at the standards in Indonesia and Australia is actually quite different. So I'm just happy with my journey because I just love learning, I think.
The student that keeps on studying. I mean, I felt like that after I did a chemistry degree and then did veterinary, and people were like, "Are you ever going to work?" And I mean, that was 8 years. So, how long has your journey taken? I mean, how many years? You said you qualified in, was it 2020?
So I started 2018, and then I finished 2022. So it's around 6 years.
Yeah. Wow. And so, on the subject of welfare, you obviously are really passionate about welfare. You've done additional. You've certainly had additional responsibility in terms of sort of advising on welfare concerns, and obviously having qualified in Indonesia and now working in Australia, things are very different. Is that correct?
Yes, it's very correct.
Yeah. So in terms of our discussion on welfare, like what is your general perspective on welfare, and what should it mean to the general public, and particularly the listeners of this podcast?
So welfare itself, it's like a well-being of the animal. Well, it's the physical needs, the physiological needs, and then the environmental and the social needs has to be met. And looking at it globally, I think it should all be the same. It just depends on how the ones that are treating it can achieve it, especially in different countries. I see both differences and like how they try to be creative to meet the animal welfare status, and then the other countries, such as in Australia, they're like very easy to attain with how advanced everything is here, and more people are actually able to afford compared to the country that I was in. So it's just very interesting to see there are different levels of animal welfare so you can achieve. And animal welfare itself is actually, it has ranges. So there's like a good welfare, there's a neutral welfare, and there's the poor welfare. So coming from Indonesia to Australia, I can see like the levels of the different animal welfares that can be attained in different countries.
So, I mean, obviously there are pros and cons. I mean, your experience in Indonesia, where resources are limited, finances are limited, versus potentially having maybe more resources or better financial support of welfare organizations. Do you see welfare being prioritized in one country over another? Or do you think that because there is a bigger need in countries like Indonesia, they are better equipped and set up for these welfares?
The animal welfare standards varies clinic to clinic in Indonesia because it just depends on how the clinics are built. Some clinics have better standards than the other clinics because of how the owners are. But as I said already, we try our best to give the gold standard. I have interned in different clinics. Like the first clinic that I went to, they actually don't really have a lot of stuff they can offer in the clinic. So people are being creative, and the community is very close knit. So if you cannot do anything, as in you cannot do an X-ray and then the animal needs an X-ray, you just revert to another clinic. So that's why you're friends with everyone. But then in the other clinics, some clinics have CT scans and MRI, I think. So they just do everything. So it really depends. It depends where you are. Some cities are more rich than the other cities, and that's also affecting the animal welfare level as well.
So going back a step, where do you feel the responsibility starts and ends with us as veterinarians? Because I know from my experience, there's often been a huge pressure on us to be supporting the welfare organizations. Is this a public's responsibility? Is this a government responsibility? Or is it for us as veterinarians, especially from a cost perspective, to be supporting these welfare organizations?
It is hard, but I would say it starts with veterinary professionals because we are educated, we know what to do, we understand what to do, and we can help them directly, at least by trying to communicate with the owner what the animal needs. Um, but eventually, if we want to have like a proper animal welfare standards that are fully met, we have to talk. We have to do an outreach basically to the other community, to the outer communities, so then more people understand, more people want to treat their animals properly. Um, and with the organizations, there are some people that just love animals so much and they try to do the animal rescues and stuff, but mostly it's NGOs, means that the government has nothing to do with it. I do have some friends, vet friends, that are very passionate about um helping the strays. It's dogs, cats, horses, and everything. And they made a organization. It's quite big, and then they try to go to the government to implement policies and stuff to stop dog meat trading in Indonesia, because that still happens.
These are broad issues, and I think important for us to be discussing, because it may have relevance for you as a veterinarian if you're working in that particular area, but obviously these are global perspectives that I think we should all be aware of. Hi there, pet parents. This is Dr. Cara, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little ones strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints, and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. I think, some of the comments and I'm going to stick on the topic of vet responsibility, because particularly in private practice, I think we all feel that there is some responsibility to contribute when and however we can. But there are often limited resources in terms of our time as private practitioners, unless you are going into welfare work as a veterinarian full time. But also from a financial perspective, because I think maybe the public have a feeling that we should be picking up the costs associated with some of these welfare cases, but it's not sustainable, particularly in private practice. So how do you think it impacts and burdens veterinarians, and in terms of even that burnout of having that kind of pressure on us?
Yeah, now that I have worked for around 7 months in private practice, I kind of understand like the burnout and the the emotional burden from it. Um, but it's hard because we try our best to advocate for our patients, but then the decision falls to the owner at the end of the day. If they don't have money, then we should, you already know, we should just seek the best treatment for the animal, even though maybe it's the euthanasia. And then talking about the euthanasia, it's also very hard because coming from Indonesia, we have different point of view of that as well, especially Indonesians that are very religious. But although I'm not really religious, but then I accept fully euthanasia, and I really agree about the decision. It's just something that we can discuss like more, even between vets. Yeah.
Yeah, and it's a sensitive topic because we know euthanasia is really an emotive conversation, even under what I would say is more sort of normal circumstances. Particularly, I think we all want to do our best as veterinarians, and we have a desire to treat and make better and ease suffering and pain. And so, from a welfare perspective, often if resources are limited or finances are limited, the option of euthanasia sits as quite a priority. And that's sometimes that miscommunication between the reality of what we can do with without financial support. And then often the vets feel a huge amount of guilt associated with it because they would love to be able to treat, but actually it's going to be in the best interest for the pet to be euthanized. Is that what you experience yourself?
Yeah. Even there are like behavioral and euthanasia that I found really hard because when it's euthanasia due to medical issue, we know that the patient is obviously suffering. But then with the behavioral euthanasia, it's the animal that's aggressive to the humans or other dogs, but then it's also like depends on the breeds as well, because some breeds are aggressive innately, and then you cannot like rehabilitate them. That's why the owner decided to put them down. But then it's even though I haven't done euthanasia myself as a vet because I didn't do work as a vet before, but I have um like accompany the vet that was doing it and talk to the owner that was like hysterically crying because at my workplace with not the vet that is doing all the talking about like the policy of the euthanasia or like the paperwork, but it's the receptionist, and I also do work as a receptionist there. That's why I have experienced a lot of euthanasia discussions with the owner as well.
And it is very difficult, and it requires, like you said, a huge amount of communication and open discussion in order to explain why. But it's often a time where it's not very well received.
Yeah.
So some of the resources, obviously in Indonesia, you talk about the fact that there is a great community effort for it. One of the conversations that I've had amongst friends is this, not necessarily burnout in the same way as we discuss it within our profession, but this saturation of people having to give to welfare, whether it's for animals or people, or that there are so many organizations that are asking for support, and people are now just going, I don't know where the money's going. I don't know if this is going into actual care and making or creating change. How do I know, and how do I best support organizations that are actually going to utilize the money that I'm giving for the right reasons, and it's actually going to make a difference?
It's hard for me to say the Australian one because I am still quite new in this country. So I've only been here for 2 years, but I know there are some big organizations that are internationally known as well. I would say if you want to do donations or help or volunteering, try to look for organizations that have done a lot of researches into their stuff. They probably have also published articles as well, because there are some organizations that publish articles about animal welfare, about trap and neuter program and stuff like that. So I think those are the organizations that we should try to help.
No,
I could name a few, but I'm not sure if it's appropriate here.
No, absolutely. No, I agree. And in terms of, when we were discussing euthanasia, obviously you can talk about case studies and owners that are struggling financially, and those are welfare situations, but you can also talk about shelter medicine. And how does the conversation change when you're dealing with one owner and discussing welfare versus an organization?
I actually haven't really had an experience with the shelter euthanasia because in Indonesia we try our best to not euthanize our animals in our shelter, but it also because we try our best to limit the intake of animals. That's why we don't do euthanasia, and we don't really have huge shelters in Indonesia. We always try our best to not overcrowd the shelter itself. But it also means that there's a lot of strays in Indonesia still.
I mean, one of your social media things that really resonated was when you came across a no-kill retirement situation for some cattle. Tell us a little bit more about that. I found that really heartfelt.
Okay, so that was when I did my student placement. It was only for one day, but it was really meaningful for me. So I was there for animal welfare assessment. And they actually didn't tell me anything at all about the retirement plan at first. But then we just had a tour around the farm, and then there's like, oh yeah, that one there is the retirement pen. So it's full of old mamas that are not producing milk anymore, and then they just like keep them until it's the end of their life. It's not a big farm company as well. I think that's why they could do it. So they're not like fully profit minded, I would say.
I mean, that was wonderful, but I mean, obviously not always practical. And I think, we go from, and you made mention of the behavioural euthanasia to the euthanasia because there is a medical or surgical issue that cannot be managed because of finances, up to the welfare concerns of aging pets. Is that right? I mean, if you were to categorize it, there obviously are welfare concerns within each thing that are different considerations for us as professionals.
With the euthanasia because of age, I think sometimes some of the cases they look into the future problems that the animals may have in the future and whether it will reduce their quality of life. So I think more people are gonna be less like acceptance on that, on the euthanasia on aging pets, because some people decided to, it's okay, I'll just keep my pet until they deteriorated very, very badly, until that one day they decided to bring the pet for euthanasia. But then the other ones are like, I don't want to let my pet suffer until the end of its life. Maybe I just stop them now. So it's even more complicated than the medical ones, because medical ones are the obvious ones, but the aging ones sometimes, maybe they are sometimes related to medical ones, but sometimes they're like future problem that may happen in the future. So it's harder for the owner as well to decide.
Have you ever found yourself in a situation, whether it's been during studying or when you've been in practice now working, where you've really struggled with some of the decision making when you've known that there is a welfare issue?
I haven't really had like a one-to-one discussion with the client regarding to whether they wanted to euthanize a pet before, because it's not legal for vet nurses to do it. So I'm sorry, I can't really answer to that one.
No, but even in your experience, even from like visualizing things going, that I know we had a case and the pet was in severe discomfort or distress, and it would have been in their best interest, not that you physically would have done it, and not even necessarily from a euthanasia. We have situations where people will come in and, for example, and want to purchase medication and pain relief over the counter. And we're not able to dispense medication that's prescribed, and we have to have the pet in our care, that we have to have taken a history, gone through a clinical examination, weighed the pet, advised on the medication and the potential side effects of administering it, and then dispensed it. And we get a lot of requests for over-the-counter medication, and a huge amount of backlash and offense when we are not able to provide that. And I always wonder and worry about the welfare aspect of that pet not necessarily getting the kind of care, because if they've come for pain relief, I want to be able to provide some sort of pain relief. But owners sometimes say they're just not in a financial position to afford vet care.
Okay. So I don't know how's the law in South Africa, but here we cannot. Oh wait, it's the over-the-counter medication. I think in Australia it's a bit stricter. We can dispense paracetamol only, I think, but other than that, other painkillers, we have to see the pet within after 6 months.
Yeah, that's the same here. So we're under strict regulations. Yeah. No, that's the same. I mean, do you see a lot of that? Are there a lot of requests, or is there an understanding generally that there are limitations in terms of the regulations that we are under?
So I haven't actually see anyone that just order paracetamol. I think because they can order from other just the pharmacy stuff, and they know the dosage, because sometimes the pet already went to the clinic, and then they know the dosage given by the vet, and then they just keep doing it. Maybe actually that happens here as well, but because we don't sell paracetamol over the counter in our workplace, we don't really see it generally. But I do receive some people asking for, we call it, it's like the binder for the poo. They ask for it a lot because the pet keep having diarrhea. But then we also tell them, if this is like maybe the third time of buying the same thing, we told them that maybe there's another underlying issue. This is maybe the diarrhea caused by something else. So we greatly recommended to you bring the pet to us, something like that.
Absolutely. No, I mean, that always, makes me concerned. Pain is obviously an easy thing to identify. And I mean, let's talk about some of the welfare things that bother you or that you have to address, both in from your experience from Indonesia, but also obviously working in general practice. What are the things that owners need to recognize as fundamentals of managing welfare in their own pets?
It actually starts from when they want to bring the pet to the clinic. Like putting the cat into the carrier, we want to make it fear-free. We want to make it stress-free. But sometimes owners don't understand because they never told to do it. They never told the correct information. I think the best way for us to, as a veterinary professional, is when they arrive to the clinic and then we see the pet is very stressed, we want to ask them, or even give a handout for how to bring your pet to the clinic with stress-free. And it's stuff like that, because animal welfare is very complex. It's like a lot of different parts that you can see. Some of them is like the physiological stress, because it's from the mental state. We want them to be free. We want them to be comfortable, and then it starts from where they arrive to the clinic, and then after that, we can help them to make it like a positive experience for the pet and for the client as well. So then the pet, when they want to go again, it's not going to be scared.
Yeah, I mean, and I find that fascinating how, we used to expect the basic 5 freedoms to be the discussion point in terms of, you don't want pets to be hungry, you don't want them to be thirsty, you want them to have access to bedding and shelter and so on and so forth. And now we are actually considering their mental state, which is wonderful. And we can do that both, it doesn't cost a huge amount. It doesn't require necessarily financial backing in order to make that journey a pleasant experience for your cat, for example. I love that.
Mm-hmm. Exactly. Yeah, it's just, they just need to be educated more.
Definitely. And I think, the discussion that we're having, and I think, it starts at the schools, at the veterinary schools. I know, we did, and I haven't been qualified that long, obviously maybe a little bit longer than you, but we were not aware of how serious it was not to scruff a cat. I know that during some of the rotations, we just didn't know any different, and that was part of handling. And obviously that is something we wouldn't dream of doing now, but it's not that long ago that people who had great intentions, and it wasn't from a cruelty perspective, it was from a safety perspective, both for the owners and for the pet and for the person handling or administering medication, scruffing wasn't a problem. And obviously we have come so far in terms of welfare considerations for pets from a psychological perspective. And I think that's incredible.
Yeah, I did know as well that scruff was something that is very bad for cat. But then until like a few years ago, when I read something about that, and when I joined the animal welfare committee, I realized that I didn't know so many stuff before. And it was just, I don't know, I just feel ashamed because I was supposed to be the one who advocate for them. And then I want to give them like the best life possible. But then we didn't realize that we like unintentionally make them not nice, or it doesn't feel nice.
Absolutely. And I mean, I think we can only become progressively more informed. And, we have to accept that, we're doing the best we can with the information that we have available. But I think, as we go through our careers, there is access to more information, and we're trying and failing at various things. But it's definitely the level of welfare and care is improving, both in underprivileged countries, but also in our general private practices. And that's only a positive thing as far as I'm concerned.
Yeah, I honestly think that there are actually still some clinics that still do scruffing, because those kind of information, they don't really reach my country, like Indonesia, like quickly, because I think of the language barrier as well.
Yeah, totally. So let's go back to who bears the responsibility from your experience when resources are limited, whether it's finances or there's not necessary equipment in these welfare situations? Is it, I know you say it's the responsibilities of the vets to be having those discussions, but should we be taking on that emotional burden?
I think at the end of the day, some people are more sensitive than the others. Vets are generally very empathetic people as well. So I think even if we don't want to take the emotional burden, some nights we just think about it over and over again. We like, did I do something right? Or is there gonna be like a better option if I do this, do that, and then something like that. So although we try our best to not take on the emotional burden, maybe I think some people still do, like me, for example.
No, absolutely. I think, it's difficult. What is your general approach for explaining to people that welfare is an important consideration in any decision making, whether it's, to treat, to euthanize, to bide your time, to put resources like finances behind, say, a workup? What is your general approach in terms of having that discussion? Are there any tools that you've used that may equip us in terms of having a conversation that informs pet owners to be making the right decision for their pets?
I haven't actually had that kind of private experience with the actual pet owner. Maybe because I haven't really worked that long as well, but I try my best to use my social media platform to tell, like, this is the good thing, this is like the welfare, this is the new information. Even in my stories, whether I'm like new guidelines or new journals, when I attended conferences and stuff, I try my best to tell my colleague as well. Actually, I try my best to tell my colleagues so then they can talk to pet owners properly with animal welfare in mind, with like the newest updates on the research, for example.
And I mean, you're able to reach quite a wide audience. And like you say, you discuss a lot of things on your social media platform, but you also do it in a very warm and light way. Sometimes, obviously, having these kind of conversations, and particularly me putting you on the spot today in a podcast interview, the nice thing is that, vets are turning up in that space and sharing those experiences. And sometimes by sharing them and giving our intentions or an explanation behind it can actually provide clarity rather than facing that when you're in the situation with your pet.
Mm-hmm. We're actually doing, we, as in me and my committee, we're actually making a euthanasia survey. I'm not sure when they're gonna spread it out, but we are in the making of it and we're almost done. But yeah, it's gonna be published on the organization about the euthanasia surveys, mostly targeting the private practitioners. So we want to have more accurate data and updated data and stuff, so then we can actually have a study.
And so what are you hoping that will achieve?
I want to, especially for people from third world countries, let's say, there are still some vets that don't want to euthanize pets because of their religious belief. I think that's actually harmful for the pets because we don't want to bring harm to the pet. We don't want to keep them suffering. I think by having that survey, it's survey targeted to vets, not like to general people. I wish from that survey where we have the data and then we can make a study out of it. It's going to be a long process, but eventually I wish that people can see euthanasia as a beautiful thing to do because we want to end the suffering of the animals. It's not just like because we are taking their life away. We don't take their life away. We just want to make them feel painless and happy at the end of their life.
Absolutely. No, I think, welfare is obviously a very complex conversation and it's applicable to all, it's globally significant. And obviously it's been so nice to get an insight from you, from your experience in Indonesia, where you say, from a community perspective and coming together and resource perspective, where you wouldn't necessarily anticipate it because there isn't financial backing, but there is, a community feel and there is the ability to help other practices if they don't have that capability, to sometimes, obviously, the realities of working in private practice or in countries like Australia and in South Africa, where we may, financially be in a better position, but it's not always that those finances are like shuffled into into the hands of people who can then provide improve welfare conditions, especially for the animals like strays. And we have a real problem of strays in South Africa. And that also, not only from a welfare perspective, but also from a public health and infectious disease perspective, is very serious.
Yeah, I think South Africa maybe is a little bit more familiar to Indonesia, like in the terms of the situation of the strays. Because in Australia, there's like no strays here. So
it's so different, isn't it? And in terms of a public health issue, obviously in Indonesia, where there is the desire to keep animals alive and to keep shelters free of that being in that position, are there any infectious disease issues in that country that sort of also impacts the welfare?
In terms of strays, there is a lot. It's sad to see because I grew up surrounded by a lot of strays, but it's like they change the strays itself. The cats, usually it's cats. The cats, they change every few months because I know maybe they die from the viruses or they die from the hit by a car situation. But in terms of shelter, I have done it's a very short externship, but it gave me a lot of insight. So before they accept a new animals, they always try to quarantine it for a few weeks. And then after that, they introduce it to the communal area. So that's how we prevent it from the virus to spread around the facility.
They're very good at managing sort of the spread of disease in your country.
Yeah. They're very strict.
Does help. Yeah. No, because as we know, obviously any disease process can be a painful process. And suffering even from a welfare discussion that we're having here can be, respiratory distress. And like you say, if they're roaming, it's, being hit by a car and the risk of them ending up in situations that are dreadful, disease and death. So I think, from that perspective, we've got a long way to go in South Africa in terms of supporting our pets that are not owned by the nice listeners potentially that are listening to this podcast, but that are either in welfare organizations and trying to find homes, but also on the streets.
Yeah, growing up in Indonesia, that's why my love for animals grown, and the animal welfare issues that's very apparent in Indonesia as well. But looking at Indonesia now, there's a lot of NGOs out there with the vets that are very passionate in welfare that try to help and to tackle the problem. And it's not only on national level because there's not many organizations out there that really cares deeply about animal welfare. That's why even though they are working in national level, but they got a lot of support from international organizations as well. Because it's just they're just full of passionate people, and I was so lucky to be able to see and to meet those kind of people attending their conferences and everything.
Definitely. That must have been, you must have gained a huge amount of insight into the needs worldwide.
Yeah.
And I know that we're running out of time, and this is a very broad subject. So hopefully at some point we can catch up and we can go into it a little bit further. But I'm so grateful for your time today. Thank you very much for sharing your experience, and good luck with your career in Australia. Obviously working as a nurse at the moment and going to do veterinary exams in the future. And if people want to follow you on social media, how do they find you?
So I'm active on Instagram mostly. I do Facebook stuff as well, but I just started. So maybe if anyone that's listening to this want to look for me, go to Instagram and at Adinda DVM.
That's wonderful. Thank you so much for your time. I'm sorry about all the technical issues before we got started, but it's been a really great conversation. Hopefully a nice introduction into some of the complexities around animal welfare and how it's not just a non-profit issue or an issue with strays, that this is something that we tackle both in first world and third world countries. So I'm super grateful for the time that you've taken. Thank you. It's been great talking to you.
Thank you. I'm grateful too. And it's a very broad subject. I hope I touched some of the important stuff, because I cannot possibly talk about everything in details within 60 minutes.
And I think, the important thing is that we are open to discussion about this. And I think that's the important thing, is that, we're recognizing the importance of having these kind of discussions. And these are little topics that we're just touching on. But I know that through your social media that, these are the kind of things that you will connect with your audience on, because they're relevant topics, and do so in a lighthearted way, which is why I love your content. So thank you so much. Thanks for all the work that you do.
Thank you.
Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Oh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.